The honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. I am pleased to rise today to speak to the question I asked the Minister of Health about Bill C-2, the former Conservative government's so-called Respect for Communities Act. I want to begin by taking a moment to commend the Minister for her decision to visit Insight, Vancouver's life-saving safe injection site, in January. This visit was an important symbol of the welcome and necessary change in tone from the Liberal government with respect to evidence-based harm reduction policy within our healthcare system. I myself have visited Insight and can attest firsthand to the incredible work Insight does to reduce overdoses, lower the transmission of infectious disease, provide essential health services, including addictions treatment, and most importantly, save lives. However, words are not enough. Communities with individuals suffering from addictions, serious mental illness, and infectious diseases need a better, more responsive, and more caring healthcare system. Therefore, I was shocked by the Minister's statement in March that she has decided not to repeal Bill C-2. This harmful legislation runs diametrically against progressive health policy and erects unnecessary barriers to the opening of new life-saving, safe consumption sites in communities that need them right across Canada. Upon the passage of C-2 in June 2015, a coalition of 65 health, patient, and harm reduction advocacy groups from across Canada issued a public declaration condemning this legislation. They broadcast a clear warning to the Canadian public about the serious problems with this legislation. Here are a few quotes that sum up their position. Bill C-2 will put the lives of vulnerable Canadians at risk by establishing excessive and unreasonable requirements for health authorities and community agencies looking to open or continue operating supervised consumption sites. The bill establishes 26 new requirements that applicants must meet before the Federal Minister of Health will even consider an approval to operate a supervised consumption site. Finally, the barriers this bill presents to accessing supervised consumption sites will allow a public health emergency to be treated under a law and order agenda, exposing patients and communities to infection, suffering, and death." End quote. Among the prominent signatories to this declaration were Toronto Public Health, the BC Centre of Excellence in HIV and AIDS, the Association of Ontario Health Centres, the Canadian HIV/AIDS Legal Network, and the BC Centre for Disease Control. And calls for more harm reduction facilities are only growing as overdose deaths continue to rise across Canada. Just last month, British Columbia Provincial Health Officer Dr. Perry Kendall declared a public health emergency after more than 200 overdose deaths were reported in my province in 3 months. Nearly 300 Albertans died of overdoses in 2015, more than double the 2014 death toll. Similarly, Ontario has seen a 72% increase over the last decade. Now, health authorities in Montreal, Toronto, and Victoria are working to open life-saving harm reduction facilities as they struggle to save lives. Unfortunately, the onerous provisions of Bill C-2 continue to delay the opening of new safe consumption sites. Madam Speaker, it's time for the Minister to move from symbolism to action in harm reduction and commit to repealing Bill C-2 once and for all. Will she do so?
Honourable Parliamentary Secretary to the Minister of Health.
Madam Speaker, thank you for the opportunity to address the concerns raised by my colleague, the member for Vancouver Kingsway, regarding the federal process to allow for the operation of supervised consumption site. I would like to start off by acknowledging the alarming rise in opioid-related overdose deaths occurring across the country. Drug use is a significant public health and safety issue in Canada that can have wide-ranging impacts on individuals, their families, and communities at large. One of the most devastating impacts is losing a family member or friend to a preventable drug overdose. Madam Speaker, that is why our government strongly supports a comprehensive public health approach to addressing problematic drug use, one that is based on compassion and collaboration and is guided by scientific evidence. In this case, the evidence is absolutely clear. Such an approach must include harm reduction. Madam Speaker, our government is working hard to ensure that harm reduction measures are part of our approach to drug policy to help prevent the transmission of infection diseases, overdose deaths, and stigma. We have also shown support for supervised consumption sites, which provide a controlled space whereby people who use drugs can bring their own substances to consume under the safe supervision of healthcare professionals and at the same time gain access to other health and social services, including drug treatment. Madam Speaker, in January of this year, after a thorough and rigorous review, Health Canada granted an exemption from the Controlled Drugs and Substances Act for the Dr. Peters Centre, a leading HIV/AIDS treatment centre, to provide supervised consumption site services as part of its programs. And on March 16th, Health Canada granted Insight an unprecedented 4-year exemption. Insight is one of the most established and well-researched supervised consumption sites in the world. It is an excellent example of what an integrated public health approach to problematic drug use can look like. Earlier this year, the Minister of Health had the privilege of visiting Insight and speaking to the staff and clients there. There is a reason why people from all over the world look to Insight for advice on implementing their own sites. Madam Speaker, yes, Insight provides a clean and supervised space for injection drug use, but it is so much more than that. It offers a holistic program where diseases is less likely to spread, overdose deaths are averted, and individuals are more likely to have access to health and social services, including immunization, counseling, and drug treatment. Our government anticipates receiving more applications for supervised consumption sites in the future. We will ensure that they are diligently assessed so that informed and evidence-based decisions can be made. Madam Speaker, in closing, it is our government's belief that effectively addressing problematic drug use requires a comprehensive and compassionate public health approach that is inclusive of evidence-based harm reduction measures, including supervised consumption sites. Thank you.
Member for Vancouver Kingsway.
Thank you, Madam Speaker. As drug overdoses continue to kill more and more Canadians, the Minister has failed to act proactively on another serious issue. In recent weeks, the Minister has decided to abandon new regulations to require tamper-resistant forms of powerful opioid prescription drugs. The Minister has stated that she believes these regulations will not solve the problem because they are only applied to a single opioid drug, OxyContin. But the solution to that is obvious. We need to bring in tamper-resistant regulations across the entire class of opioids, as the US FDA has done. Madam Speaker, Canada is in the midst of an opioid overdose crisis. Hundreds of people are dying, and British Columbia has declared a public health emergency. Madam Speaker, more people will die. So why won't the Minister introduce tamper-resistant regulations to the entire class of opioid drugs and help save lives?
Honourable Parliamentary Secretary to the Minister of Health.
Thank you, Madam Speaker. Madam Speaker, to operate legally, a supervised consumption site requires an exemption under the Controlled Drugs and Substances Act, Canada's drug-controlled framework. The purpose of this act is to protect public health and maintain public safety, and it is federal government's responsibility to ensure that it is upheld in all circumstances where activities with controlled substances are taking place. Health Canada requires sufficient information upon which to base any decision allowing an exemption. For this reason, requirements to demonstrate that a supervised consumption site will be properly established and managed predate the Respect for Communities Act. I acknowledge the concerns being voiced by the member. However, the recent approval of exemptions for the Dr. Peters Centre and Insight demonstrate that the existing legislation does not preclude sound and evidence-based decision regarding supervised consumption sites. Thank you, Madam Speaker.